My name is Dr. Rotimi Johnson. I'm a vascular and interventional radiologist with RJ Medical Group. Today I will be talking about benign prostatic hyperplasia, also known as BPH. Benign refers to not cancer. Prostatic means prostate. Hyperplasia means increase in the number of cells and increase in the size of the cells. The prostate is a small gland about the size of a walnut. It is located and sits below the bladder and above the penis. And these three organs are connected by a tube called the urethra. The bladder is a muscular pouch that collects urine from the kidneys. When a man is ready to urinate, the bladder squeezes and pushes the urine through the tube called the urethra, and this urine passes through the prostate and through the penis out of the body. There's another tube called the ejaculatory duct that passes through the prostate. This tube receives sperm from the testes and carries the sperm through the ejaculatory duct to the urethra in the prostate and out of the penis when a man ejaculates. One of the main causes is testosterone. Men begin to produce testosterone from childhood and throughout life. The production of testosterone peaks about age 30. This testosterone is then converted to dihydrotestosterone by an enzyme that is made in the prostate. This enzyme is called 5-alpha reductase. So when dihydrotestosterone is made, it acts as a very potent stimulant for increasing the number and the size of the prostate cells. And when this happens, the prostate begins to enlarge. Most men will develop BPH as they grow older, so that the incidence of BPH is between 40 to 50% of men at age 50 and about 80% of men by age 80 will get this BPH, this enlargement of the prostate. Also, men who are overweight are more prone to getting BPH. Black men will get BPH at a higher rate than men of other races. Some of the ways to reduce the progression of BPH is by diet and exercise, avoiding alcohol, and eating a low-fat, high-fiber diet. There are three major categories of symptoms of BPH. First, there's the obstructive symptoms. And this has to do with the tube or the urethra being compressed, so that when a man tries to urinate, he needs to hesitate to generate the pressure to urinate. And when the urine comes out, it's a slow flow and it splits and it can spray. And there's a lot of straining involved. The bladder cannot store the urine properly, and the man gets an urge to urinate, and he needs to rush to the bathroom and wake up at night every 2 hours to urinate. And also, there can be leakage of urine because the bladder cannot hold the urine. Some of the conservative measures for BPH include a lifestyle modification. Patients are told when to stop drinking fluids in the evening, and they're told to reduce their alcohol intake and coffee intake. Some patients get a prescription for saw palmetto, which is a herbal supplement over the counter. For patients who suffer from urinary incontinence, they can be provided condom catheters. Other patients who may have obstructive symptoms can be provided with self-catheterization while further investigations and treatments are being planned. When BPH progresses to the point where patients are getting urinary retention and can no longer be managed by medications, these patients are often referred to specialists such as a urologist, or to myself, a vascular and interventional radiologist. The minimally invasive treatments used to treat BPH do not remove the prostate. Okay, they are same-day procedures, and they do not change the anatomy. The first minimally invasive treatment I will talk about is prostate artery embolization, which is one of the procedures that I perform. The benefit of prostate artery embolization is that it can be used to treat prostates of any size, and it actually performs better in treating very large prostates. It involves placing a tiny catheter through the artery in the wrist or the groin, advancing the catheter on the live x-ray directly into the prostate artery, injecting dye in the prostate artery and seeing the enlarged prostate, and injecting tiny beads to block off the blood flow to the prostate. These beads will lodge in the prostate and cause the prostate gland tissue to be destroyed. When this happens, there's no pressure on the urethra, and the muscles also are devitalized so that they cannot squeeze the ureter. The other minimally invasive treatments are performed by urologists, and they include placing devices through the penis ureter, but they're done while awake with mild sedation. Advance through the prostate ureter into the prostate, and water vapor can be turned into water and release energy to destroy the prostate, or microwave energy or radiofrequency energy can be used to destroy the prostate. But the disadvantage of this treatments is that they can only treat small prostates, less than 80 grams. There are two classes of surgeries performed in BPH. The first one is the TURP, which is most commonly used to treat prostates that are generally smaller than 80 to 100 grams. This surgery is performed using general anesthesia or spinal anesthesia. A device is placed through the penis, and using an electric arc, the prostate is shaved off from the inside out. The urethra and the ejaculatory ducts are disrupted. The other surgery I'm going to talk about is used to remove large prostates. The first one is called the OLEP, which also involves placing a device through the urethra using a laser to separate the prostate from the outer capsule of the prostate, pushing this prostate tissue into the bladder, and then using another device to remove the prostate out of the body. This also removes or destroys the ejaculatory duct. The third type of surgery I'll talk about is a prostatectomy, using either by open incision or using a robot. In a prostatectomy, the prostate is cut off at its connection to the bladder and its connection to the penis. And the stitches are placed, and they're used to attach the penis directly to the bladder. The benefit of surgery is that they work faster to treat the obstruction symptoms, and patients are able to urinate freely faster. However, because of the disruption of the anatomy, there can be incontinence when a patient sneezes or exercises where they're leaking urine. Because the ejaculatory duct is disrupted, there can be difficulty ejaculating. BPH is a non-cancerous growth of the prostate that restricts or blocks the flow of urine out of the body. The size of the prostate and the symptoms of BPH progress as a man ages. The symptoms can be objectively assessed by the patient by filling out a questionnaire. There are several investigations that are used to confirm the diagnosis of BPH or to exclude other possibilities or conditions that can give the same symptoms. There are many treatments of BPH, including conservative treatment, medications, minimally invasive procedures, and surgery. All of these treatments work. It is very important that when a patient goes to see a specialist or a general practitioner for management of these symptoms, that they are provided with information on all the treatment options, and that the patient is given the appropriate treatment or referred to the appropriate professional specialist to do the appropriate procedure for that patient. Thank you. Please don't forget to subscribe and check out my blog at rjmedicalgroup.com.